Good morning everyone. Today we group 1 are going to tell you about the signs and symptoms that lead to the usage of ORS and the signs which depict that ORS is working. Common causes for the use of ORS, why and when we give the oral rehydration solution. ORS is mainly used to treat dehydration, and dehydration is mainly caused by first diarrhea. It is the most common reason. It causes loss of water, sodium, potassium and bicarbonate. It is seen during viral infections, bacterial infections and food poisoning. Second reason could be vomiting. It causes fluid and electrolyte loss. It is seen in early pregnancy, infections, etc. Third reason could be fever. High temperature increases the insensible water loss through skin and lungs, especially in the children and in the elderly. Fourth reason could be the heat stroke or excessive sweating. In hot weather, sweating causes a loss of water and salt. It is more common in the athletes and the people who are continuously working outdoors. Inadequate fluid intake. Babies and elderly or sick patients who do not drink enough can lead to the mild dehydration even without diarrhea. So, what are the basic symptoms in which the ORS should be given? These symptoms indicate the mild to moderate dehydration where the ORS usage can be effective. Increased thirst. It is the first sign of water loss. Dry mouth or tongue. Saliva production is decreased. Sunken eyes, especially in children. Reduced urine output. Dark yellow or concentrated urine. Irritability or restlessness seen in children. Fatigue or weakness due to the low blood volume. Mild dizziness, especially when standing. These symptoms tell us to start ORS immediately to prevent the worsening of the symptoms.
Now let's see the composition of the ORS. WHO ORS 2004 reduced osmolarity formula. ORS powder is dissolved in 1 liter of clean potable water. The composition is as follows. Sodium chloride 2.6 gram per liter. Glucose 13.5 gram per liter. Potassium chloride 1.5 gram per liter. Trisodium citrate dihydrate 2.9 gram per liter. Total osmolarity, that is 245 milliosmol per liter. This is a reduced osmolarity formula compared to the older ORS which had 311 milliosmol per liter. Lower osmolarity reduces stool output, vomiting, need for the IV therapy. What happens if they are given separately? Like sodium and glucose, if they are given separately, what will happen? Sodium alone. If you give sodium alone without glucose, a very little sodium is absorbed. Water absorption is also poor because sodium is not effectively taken up into the body. Glucose alone is not sufficient to absorb sodium, may cause a rise in the blood sugar without correcting the electrolyte loss. Thank you.
Now let us look at the positive signs that the ORS is working. Improved hydration status. There is a decrease in thirst, improved skin turgor, skin springs back when pinched, moist mouth and tongue, decreased sunken eyes appearance, increased urine output and a pale yellow color of the urine returns, improved level of consciousness and activity. There is a resolution of dehydration symptoms. There will be no dizziness or faintness and stable pulse and the blood pressure returns. There won't be any signs of shock. In infants and children, the improved weight can be seen, which is lost due to the loss of water in the dehydration state. Will be having mild effects. Signs of incorrect use of ORS like vomiting, abdominal bloating, hypernatremia and overhydration. Vomiting occurs especially if ORS is given too quickly. So ORS is given slowly in small sips like 5 to 10 ml every 1 to 2 minutes, and abdominal bloating occurs due to overconsumption of or improper dilution, and hypernatremia is a rare condition. It is a condition where increased sodium concentration in blood. It occurs due to ORS is overly concentrated, and the signs are irritability, lethargy, twitching and seizures, and overhydration occurs mostly in children with kidney or heart diseases. Signs are puffiness and breathing difficulty. Thank you.